one of the things that we did is we talked about a vision for what it means to be patient-centered. And so there are three things that I want to point out from this vision. One, nowhere in this vision do we use the word patient. Patients are people who have a condition, but they are not always defined just by the condition. Patients are mothers, they're fathers, they're sisters, they're doctors, they're lawyers, they're people who are writers. They have other things that they want to do other than to be patients. And so we need to recognize that oftentimes these are just people who we're working with, and it's not an entirely different type of group that we're working with. The other thing is that for much of what we're doing now in terms of the medications and the services that we're providing, it is for conditions where patients have to manage much of these conditions for themselves. And so whether you're talking about autoimmune disorders, whether you're talking about the chronic diseases such as diabetes and hypertension and cardiovascular disease, for the vast majority of time, patients will come in, they might see me as a clinician for 12 minutes, and then the rest of their time is spent managing their conditions. So we need to start to ask ourselves, when we have an opportunity to engage with patients, what do we do to help them take control, to get their lives back, to get back to being the mother, daughter, sister, brother who they want to be. And then lastly is the focus on outcomes. Again, what we want to do is not just focus on bringing in and engaging patients, but really having a clear line of sight to how the work that we do can improve their outcomes. So as I said, the three important points for this vision is that we're talking about people, we want to give them the ability to take control, and we want to have a focus on improving outcomes.